angioplasty was done at Narayana Hridayalaya, and he was walking 45 minutes daily, and his routine was very strict. He used to take all the oral medications prescribed with the cardiologist. But after 1 year, he was not able to walk for 45 minutes. After 10 or 15 minutes, severe chest pain, like angina pectoris, he's affected and he has to stop walking. Then he consulted the doctor again, and the doctor examined him, and the doctor understood that everything is normal. His lipid profile is normal. His stent is on the right position, and nothing has to be worried. He told the patient that actually the blood, arterioles, small arteries supplying the myocardium got blocked, and that is why you are feeling pain, and for which we are not having any remedy. If you want, I can increase the dose of aspirin, a blood thinner, but that may cause severe other complications like gastric bleeding and everything. Hence, I want to do that. I think better to adjust your walking. So you walk for 10 or 15 minutes. Whenever you are feeling pain, you just stop, and after that you can again walk. In that way you have to walk, because effective remedy is not there. What can I do? Actually, the cardiologist is helpless in this case. Hence, the patient approached me because, his son was studying for Ayurveda in Karnataka. I think that may be one of the reasons he got some relationship with Ayurveda. Next. You see, now the patient is sitting with us. Now let us think about the organ heart. You see, Ayurveda has given much importance to heart diseases, but it is explained in a very short form, and even a single chapter is not allocated for Hridroga. Chardi Hridroga, Trishna, like that, Akhyaya Nidarasana, it is explained, because it is not having that much of not given that much of importance for Hridroga. But even Hridaya is a major organ. You see, Hridaya is a sthana of Oja. You all know that Ojas is situated in Hridaya. Now, next one is one of the Desha Jivita Thamani. Hridaya is one of the Desha Jivita Thamani, and it is one of the Desha Pranayatana. Moreover, Hridayam Chedanasthanam Mukta Sutra Degina, Tamobude Tasmistu, Nidra Vishati Degina. Susura says that Hridaya is the Chedanasthana. Moreover, Hridaya is one of the Kotangas. Kotanga is Tiranyeshu Hridayam Pramamukusam. Hridaya is one of the Kotanga. See, Hridaya is having much importance because it is the sthana of Vyana Vayu, Sathaka Pitta, and Avalambaka Kappa. You see, all the Tridoshas are situated in Hridaya. Vyana Vayu, Vyano Hridistita. Vyana Vayu, Sathaka Pitta, Avalambaka Kappa, and all these three doshas are situated in Hridaya. Moreover, Resavahanam Srodasam Hridayam Moolam Mahasrodashta. It is the Resavaha Srodosthanam also. Resavaha Srodosthanam, and Pranavaha Srodas also, the Moolasthana is Hridaya. In this way, Hridaya is one of the most important organ in the body. Moreover, it is the one of the in Trimarmaya, Shiro Hridaya Vasti. It is one of the Trimarmas explained by Acharyas. Hence, Hridaya is having much importance in a wider importance. It's a very important organ which has to be protected every time, always. Next slide. Next. Here, Hridroga means, and myocardium. Why, doctor, some color difference is there? Here I am explaining about myocardial infarction. Again, it is not good. I think the previous one is good. This is good. Here, Hridroga means, myocardial infarction. According to classics, no specific nidana is explained for Hridroga. Tesham Gulmanidanoktei Samuttanaishta Sambhava. Tesham Gulmanidana and Hridroga Nidana are similar. You all know that, Gulma is the symptom of a Pratiloma Gati Vayu. Gulma is a Lakshana of Pratiloma Gati Vayu. The reason for Gulma is Pratiloma Gati Vayu, and so the treatment should be Anilomana. Same treatment principle for Hridroga also. Then one of the quality of a Hridroga Aushadha should be Anilomana. This is the lesson which we are studying from this. Tesham Gulmanidanoktei Samuttanaishta Sambhava. This is the lesson which we are learning from this quotation. Next. You see, Samprapti of Hridroga. Actually, Hridaya is the Asthana of Hridroga. No need to mention, because Hridaya is the Asthana, and the disease is affecting the Hridaya organ, and that is why it is called Hridroga. Hridaya is the seat of Rasatatu. I already explained. Rasa situated in the Hridaya got vitiated due to vitiated dosha and resulted in Vedana and other symptoms. Dosha dusta rasaihi sadhun dushayati. Like that, the samprapti of a common samprapti of all diseases. But here the Hridroga samprapti is explained in Madhava Nidana. Dushayatva rasam dosha viguna hridayam gata hridibadha prakurvida hridrogam tam prachakshate. You see, dushayatva rasam dosha viguna hridayam gata. Viguna means pratiloma gati. Vidushayatva rasam. Rasadushti is very prominent in the Hridroga, which means that, Rasadushti always occurs due to Agni Mandya, because proper when the food is digested, from that Anna Rasa is developed. From that Anna Rasa, Rasa Thadu is developed, which means that, if Anna Rasa is not properly made in the body, if Agni Mandya is there, definitely there is every chance of having Dushta Rasa. If this Dushta Rasa is directly going to the Hridaya, because I already told you that Rasatha Mula is Maha Koshta and Mahasrodas and Hridaya. Hence, this Rasadushti actually leads to goes to Rasa, vitiated Rasa goes to Rasa Hridaya. Athaya means, Rasa, and Hridaya, here, Athara is Hridaya. Hence, this Rasa vitiates Hridaya, and this is why Hridroga is evolved. Which means that, Samprapti of Hridroga is very easy to understand, because there will be always Agni Mandya, and Vigunata of Vayu also will be there, by which, Rasadushti occurs. This vitiated Rasa goes to the Hridaya, and there also it produces some level of problems which can be called as Hridroga. Very simple explanation of Samprapti is explained in Madhava Nidana. Dushayatva rasam dosha viguna hridayangata hridibadha prakurveda hridrogam tam prachachate. Next. Okay. You see, Hridaya and Koshta, I already explained. Moolastana of Rasavakasrodas is both the Hridaya and Koshta. Hence, is there any abnormality in the regarding Agni or diet? The first organ affected will be Hridaya. If some abnormality is there in the diet, and if some abnormality is regarding Agni, definitely the proper digestion may not occur, and Rasadushti will be there, which will be firstly reflected on the organ Hridaya. Hence, if you are following a healthy diet, and if it is getting digested properly, that will be Hridya. Hridya means good for Hridaya, which means that, we have to keep the Agni in a proper way for preventing Hridroga. Now we got two treatment clues. One is all the medicine should be Anilomana. The next one is all the medicines which can be used against Hridroga should be promoting Agni or Pachana and Deepana. Whatever explanation given by Acharya is actually a clue for developing the treatment principles that we have to understand. We are using the basic principles also. Next. According to Susura Samhita, you see, Shonida Varnani Adhyaya is told, there he says that Tatra Panja Bhaudikasya, Shadrasasya, Chaturvithasya, Divitha Virasya, Ashtavithas Virasiva, Samyak Parinadasya, Estejo Puda, Saraha, Parama Sushmaha, Sarasa Ichuchide. You see, Parama Sushmaha. Actually, I already told you that Rasa is formed from Anarasa. This Rasa Dhatu is Parama Sushmaha. If some Visheshan is there, which is very difficult to detect, because this Rasa Dhatu is Parama Sushmaha. We can see Rakta Dhatu, but we cannot see Rasa Dhatu because it is Parama Sushmaha. Actually, when Arunadatta comments, he says that Parama Sushmaha means Adishayena Sushmaha, which means that, very, very Sushma, very subtle, which means that, this Rasa Dhavu is Parama Sushmaha. If some vitiation is there, which is very difficult to detect, actually, when the disease is developed, then only we recognize that, this Rasa Dhatu was vitiated very early. We were not able to fight it out because Rasa Dhatu is Parama Sushmaha. Next. You see, from Ahara Rasa, Ahara Sara is formed and Kittavaga is formed. This Ahara Sara, Rasa, which is lodged in the Hridaya. Actually, when in Ashtanga Sangraha one quotation is there, Rasadisthayeshu dosheshu Yataya Sambhavanti Tajani Tipacharena Tanahu Kritadakavat, which means that the dosha particles which is situated in the sadhus, if they are vitiated, those dosha particles are vitiated, definitely that will vitiate the sadhu also. Once again, I can say, Rasadistheshu dosheshu Yataya Sambhavanti. Dosha particles which are situated in the dhadus get vitiated. At that time, dhadu also get vitiated. There occurs dosha dhadu sammurchana, which means that at that time only roga lakshanas are exhibited. Hence, Rasa which is loaded in Hridaya through 24 dhamanis, Chaturvitha Dhamani, Chaturvimshati Vitha Dhamanis are there, from which it is pumped from heart by the Vyano Hridisthita, Vyana Vayu. Rasa responsible Tushti Prinana Rekta Pushti Vistu Rasa. This is the function of Rasa Dhatu explained in Ashtanga Sangraha. Tushti Prinana Rekta Pushti Vistu Rasa Jivana Varna Prasadana Mamsa Poshanai Rasrik. Actually, he is explaining the Dhatu Karmas in a very good way in Ashtanga Sangraha, which all the doctors should study by heart. Tushti Prinana Rekta Pushti Vistu Rasa, which means that Rasa has got Tushti Karma, then Prinana Karma, and it also helps in the formation of Rekta Pushti Vistu Rasa. Next. Then, let us see Agnimanti, what is the relationship between Agnimanti and the Susti. Gurishidam Adisriktam Atimatram Samachintam Resavakari Dushindi Chindianam Jatin Sevanan. Gurishidam Adisriktam Atimatram Samachintam. We all know that the Guru, Shida, Adisiktha, and Atimatra Bhojana definitely causes Agnimantiya or Agni Vaishamya. Definitely, which means that is the reason of Rasa Dushti. If you are keeping Agni in a proper level, Rasa Dushti cannot occur, by which Vidraga also cannot occur. Which means that we have, if you are properly keeping our Agni with our proper Dinacharya and regular exercise, definitely we can prevent. This is the very basic principle. We can prevent myocardial infarction. I can say very boldly because I have managed many cases of myocardial infarction without angioplasty or anything. Because set of people who are not able to undergo angioplasty, who are very fearful about angioplasty, or those people who sometimes they may be having another complications like diabetes, severe hypertension. They may not be able to undergo angioplasty. Moreover, they cannot afford. Many reasons are there. Some people approached me. I was able to manage very well. That is why I am very boldly say all those things. According to Atanga Hridaya, sometimes even you see Misram Pathyam Apatyam Cha Puktam Samashanam Matam. Like that, Samashanam, he is explaining Atyashanam. Vidyad Atyashanam Bhuyo Puktasyo Upai Bhojanam. Akale Bahava Alpamva Puktam Vishamashanam. Trinyapyedani Murtyumva Koran Vyadhin Sirjanticha. Which you see Murtyu. Actually, these rogas we study in first year itself. Then how Murti is coming with this Samashana, Atyashana, and Vishamashana. Actually, we are wondering. But when we study the basic principles and when we go to the treatment part of Sigasasana, you see, this is sufficient for Murtyu. If somebody is practicing Samashana or Atyashana or Vishamashana daily for 6 months or 1 year, definitely he may be affected with severe cardiac arrest or like that, severe myocardial infarction. That may be the cause of mrityu. Continuous practice of above apatyas may directly affect Hridaya and results in Hridroga and death. That is why Misram Pathyam Apatyam Ja Puktam Samashanam Madam Vidyad Atyashanam Bhuyo Puktasya Upari Bhojanam Akare Bahava Alpamva Puktam Vishamavachanam Trinyapyedani Murtyuva Koran Vyadhi Sirjanticha. Next. You see, role of stress, because nowadays, most of the doctors tell that this stress is one of the important positive factor for myocardial infarction. In our science also, Rasavaki, Dushyandi, Chindyanam, Sadisevana, because Atichindana is related to the Rasadushti, stress and tension results in Hridroga. We all know that, You see, when Acharya explains that the time for food intake, Visrite, Vidmutre, Kriti Subhamale, Dosheswapatale, Vishutte, Surgare, Chutupagamane, Pate Anusarati, Tathagdunau, Udritte, Vishadagarane, Dehe Chasulakau, Prayunji, Aharam, Vidhidayamata, Gara, Sakimata. He says, because when we are having no tension and we are very stress free, at that time only we have to take food, because this is this chintana or stress is related with the defective function of Agni. That is why at that time when the stress is there, we are not supposed to take food. That is why this Acharya says that the time of taking proper food is explained very well in our basic principles or science. Next. Then, relation between Ama and Hridroga. We all know that some level of Srodorotha occurs in Hridroga, coronary block, artery block, like that, if you are comparing with the modern physiology, then Rasadushti occurs, and due to that, Ama forms, Ama Sanjaya goes, Srodorotha Velepramsa, Duvirava Anila Motata, Alasya Apakti Dishteva, Nishtiva Malasanga, Rijikrama, Lingam Malanam Samanam. When Amatwa is there, definitely the first symptom is Srodorotha. That is why here Srodorotha occurs. So in Hridroga, you have to adopt Srodorothahara treatment also. Now we have come to the how a treatment principle can be evolved from these points. One, the medicine should be Pachana, the medicine should be Deepana, because Pachana, there are some differences between Pachana and Deepana. You see, most of the Pachana Ushadas are Rucha. For example, Shundi, Haritaki, Tippali, all these are Pachana, but all these are Ruchana. Then most of the Deepana Ushadas are Srikta. For example, the classical example is Krita. Krita is Deepana. The next difference between Pachana and Deepana are Pachana is having only temporary effect. If you are having some indigestion, definitely we can take some Pipalyasava or Apayarishta. But at that time we cannot take Deepana Ushada. If some temporary Agrimandya is there, at that time Pachana Ushada is sufficient for digesting getting digestion properly. Hence, Pachana Ushada is having temporary effect, but Deepana Ushadas are having long-lasting effect. Its effect is very stable. Moreover, we cannot apply Deepana Ushada in Agrimandya, which means that after applying Pachana Ushada alone, we can use Deepana Ushada, because when we use Deepana Ushada, there should be some level of Agni for digesting that Deepana Ushada. Once again, I am saying, when we use Deepana Ushada, there should be some level of Agni for digesting that Deepana Ushada, because Deepana Ushadas produce their effect only after getting properly digested. Once again, I am saying, Deepana Ushadas exhibit their Deepanatva only after getting properly digested by the Pachana Ushada, which means that we should use always Pachana Ushada first, then only we have to go for Deepana Ushada. Then you see, there are some preparations in our science, like you all know that Panchagora is one of the good Pachana Ushada, and Krita is one of the best Deepana Ushada. See, if you are combining Panchagola with Krita, or if you are preparing Krita with Panchagola, medicating Krita with Panchagola, definitely that should be a great drug. For example, in certain diseases, severe deep-seated Agrimandya is there. For example, in Rajeshma, Resoptasya Rektaya Mamsaya Kuta Evatu. Resa is not transformed into Rektatadu, then how Mamsadadu is formed? Like that he is saying. Because in Rajeshma, that much of deep-seated Resatatu Agni Mandya is there. In Udara also, Roga Sarvevi Mandegnu Udaranitu. In Mandagni is one of the major causes of Udara also. In like that certain diseases are there where deep-seated Agni Mandya is there. In all the treatment of these diseases, we have to give the patient Panchakole Vagu. Because in my practice, I always use Panchakole Vagu in most of the liver disorders, because it is good for correcting the deep-seated Agni Mandya. Then, if Panchagola is used for medicating Krita, that I already told you that will be a great medicine. You see, this Krita, Indukanda Krita, Shatpala Krita, all these drugs are very widely used for these conditions, for Rajeshma and Udara and other related cases where deep-seated Agni Mandya is there. You see, a top-rated Pachana Ushada like Panchagola and the best Deepana Ushada, if you are combining together, that's a wonderful drug, and that is why Indaganda, Krita, Shatpala Krita, all these medicines are very good for managing many of the Agrimandya related diseases. Then here, the drug should be a Pachana and it should be Deepana, and you already told that it is related to Gulma. it should be very anilomana, and we already explained that it should be Srodhorodhagara, and it should be Gulmahara also, because Gulma and Hridroga are highly related, and this is this should be the quality of any Hridroga medicine. Then next. You see, we can add one more quality to this thing, because a medicine having Pajana, Divana, Srodhorodhagara, Gulmahara, all these qualities may not be good, may not be sufficient. That drug should be Hridya also. Hridya means, it is very suitable for the functioning of Hridaya. Hence, all the qualities are there. But Hridya property is not there, that may not be a good drug for Hridroga. Let us see one more causative factor we have to explain very well, because Vegatharana and Hridroga. We have studied 14 Atharaniya Vegas, out of which 10 or even 11 Atharaniya Dharana of 10 or 11 Vegas cause Hridroga. Today itself, after the class, you just take the 4th chapter of Attanga Hridaya, Roga Anilpadini Atyayam, you take and you go through each and every sloka. You should be able to know that 10 or 11 Rotha or Udirana of 10 or 11 Vegas cause Hridroga, which means that Vegarotha and Hridroga are highly related. Then Vegatharana of truth doesn't cause Hridroga. Because fasting, Vegatharana meaning of truth means fasting. Fasting creates Rasa Shuddhi. That is why Vegatharana of truth doesn't cause Hridroga. If Vegatharana of truth is there, Tasya Yojyam Lekusriktam al Ushnam Alpam Jabojana. If Vegatharana of truth is occurring, Tasya Yojyam Lekusriktam al Ushnam Alpam Jabojana. If we were not able to take the proper time, and if we are forced to do this Vegaratha or truth, definitely at that time the right food is Tasya Yojyam Ushnam Lekhu, all these qualities, Tasya Yojyam Lekhu Snigdham Ushnam Alpam Japojanam. Because I usually tell that in Malayala, kanji is there. If you are adding some ghee to the kanji, and if it is taken half a stomach, that is the best medicine for truth nigraka. Then even the control of weeping results in Hridroga. You see, you just go and today itself you read the chapter of 4th chapter of Attanga Hridaya. You will be wondered to see that out of 14 Vedas, suppression of 10 Vegas cause 10 or even 11 Vegas cause Hridroga. That much of a relationship is there between Hridroga and Vegatharana. Next. You see, medicine should have the following properties. I already told that it should be Pajana, it should be Divana, it should be Anilomana, it should be Gulmahara, Srodhohara, and Hridya also. What is the exact meaning of Hridya? Hridya means, if some medicine is taking the quality of other medicine to Hridaya. Actually, Hridya means, it acts as a vehicle. A Hridya vehicle acts as a vehicle. For example, if you are Udaryadi Rayam Hridyo, Udaryadi Gana is Hridya, which means that, if you are adding some medicines with Udaryadi Kashaya or Krita, definitely Udaryadi Kashaya or Krita will go to Hridaya. Then if you are adding some medicine with Udaryadi, definitely it will go to Hridaya, because Udaryadi Kashaya is having affinity towards the organ Hridaya. Next. You see, let us see. First of all, let me see. Haridagi is having all the qualities. Pajana, Divana, Anilomana, Gulmahara, Srodhohara, but it is not Hridya. You see, I am explaining how a drug is developed, how a treatment is developed for Hridroga. I am coming to that point. Haridagi is Pachana, Divana, Anilomana, Ushna, Vilmahara, Srodoro, all these qualities are, but it is not Hridya. You see, cow's ghee is Hridya. Actually, ghee is having affinity towards many organs. It is having affinity towards eyes. That is why if Tripura is medicated, definitely that Tripura will go to eyes. If Kripa is medicated with some Methya Ushadas, definitely it will go to brain. You may want Kalyana Krida, Makalyana Krida, many Kridas are there. All the Methya Ushadas, if Krida is medicated with Methya Ushadas, definitely it will go to brain. Then, if Krita is medicated with Vidaryadi, definitely it will go to Hridaya also. Cow's ghee is considered to be Hridya. Hence, according to Ashtanga, Hridroga Athikara, Hridroga chapter, when Krida is told, Sauvarsana Siddhipale, Pathya, Pajashadanyude, Kridasya Satita Prusto, Hridroga Shwasa Gulma. Sauvarsana Siddhipale. So, Lekho Sauvarchalam Krityam. This explained. Lekho Sauvarchalam Krityam. Sauvarchalam is also a Kritya, and Krita is prepared with Sauvarchana and Haridagi alone. Because if Krita is prepared with Haridagi, definitely the Pajana, Divana, Anilomana, Gulmahara, Srodoro, all these effectively go to Hridaya. This is how a drug is developed. A treatment procedure is developed in Ayurveda. Actually, this is an analysis. Each and every disease, like in this way, we can analyze. According to Ashtahridaya Hridroga, this Sauvarchana, the Kritama is explained. This is the first medicine, and it is a Krita. You see, when we examine the Hridroga Athikara, many Kritas are usually. Cardiologists and other modern doctors, tell the people that you don't take any type of fatty material, including Krita or coconut oil. But according to Ayurveda, Krita is permissible to take because, Krita is having Kritya effect through which, we can induce medicines to the heart using the Kritya property of Krita. Next. You see, actually, here the patient is with us. We don't forget about the patient. The 62-year-old patient is sitting with us, and we explained how medicines can be given to him, analyzing all the basic principles and his clinical condition. You see, first of all, the medicine prescribed was Gandharva Kashaya with Saitava and Buddha. Gandharva Kashaya Budasha Vishwa Patya. In that yoga, Saitava and Buddha can be added. Then Hingvachadi Churna with hot water. Krishran, Gudman, Vara Vidmotra Sangam, Ande Dantam, Hridgadam, Pandarogam, which is it is indication of in the indication of Hingvachadi Churna, Hridroga is told. Then Vidaryadi Kashaya already told that Vidaryadi Rayam Hridyo. Here I am adding Gurgulu Panchabara Churna. If some Srodoro medicine is added to Vidaryadi Kashaya, definitely it will go. This is my principle. Definitely it will go to Hridaya, and the Srodorotha will be removed. We can remove the Srodorotha with Gurgulu Panjavara Churna. Gurgulu Panjavaram Parigamsham Magatika Triparaja Prataksya Tapudi Kashayudam Matunitam Pushta Pagandara Gulmagadik. There, you see, the Droga is not a told. But we all know that, this is a very good Srodho Rothagara Uchada, which can be added to Vidaryadi Kashaya for getting this Srodho Rothagara effect of Gurgulu Panjavara on the organ heart. Honey is the animal of Gurgulu Panjavara, that is why it is added. And here I have added one more treatment, a Kerala Chilsa, which is very cheap, with 30 ml of Another we can do Guru for 1 day, and the patient continued this treatment for 1 month. Next. You see, in between we can say another. You see, Chirvilladi Kashaya, Indukanda Kashaya, Apiarita, Desamolarita, Hanadaram Budiga, all these medicines can be also given. These are all next options, Panchavara Yavagu is given in deep-seated Agnimadhya. Then Virajana with Trivur Lekam. You see, Trivur Kashayana, Sathida Sasidokima. That is Hridyam Virajanam. It is known as Hridya Virajanam, which is available at Vaidyarattam Aushadashala. I think they are marketing this Trivur Lekam as the name of Hridya Virajanam. But in Kotak Ayurveda, it is Trivur Lekam. Trivur Kashayana, Sathida Sasidokima. This is called Hridya Virajanam. Matu Trijada Samyuktu Deho Hridyam Virajanam. Then Shavana Prasha, Agastya Rasayana, Ramya Rasayana, milk decoction, Stira, Arjuna, Rishuna, all these are good Rasayana for Hridroga also. Next. You see, after 1 month of this giving these medicines, actually the patient became all right. He was able to walk for, I think, one slide we missed. Dr. Can you search? Sir, after 1 month, one slide we missed, I think. No, not missed. No, sir, we have not missed. Because there was one slide regarding the patient. After 1 month of treatment, the patient was able to walk for 30 minutes, and after 2 months of treatment, the patient was able to walk for 1 hour, which means that, we were able to remove the block which already occurred in the minute arterioles with our management. Because applying the basic principles in Hridroga, we were able to remove the block. This line of management I have used in many cases. Not always this Gandharvasadi Kashaya. I already told that in the Gandha, the many options are there. Actually, we can choose accordingly. But all these medicines are highly effective in the management of Hridroga. The only thing is that we have to protect Agni for protecting heart. That is my principle. Protect Agni for protecting the heart. This is very, very important. Sometimes, the patient may be having good appetite. That may not be, that is not the sign of good Agni. Because, Ahara Gamsha, Sojanam Nipaka, Purisha Mutra Anila Srishtadaja. Purisha Mutra Anila Srishtadaja is also a good sign of Agni. Agni Bala. For example, if the patient is having good appetite, but he is constipated, which means that, Agni Vaigardi is there. In that way, we have to see the patient in a very holistic approach. Then, what should be the preventive measures? Now, I think you all should have understood how a Hridroga myocardial infarction can be managed. If you are getting sufficient time, definitely, it's a time-consuming thing. 1 month or 2 months it may take. Because, this block occurred due to his Abhatyahara and Vigara for many years. Many years of Abhatya only causes block in myocardial vessels. Hence, it may take some time. That is because, when Jara Acharya says that, Lankaram, Svedanam, Kalo, Yavagu, Stittako Varasa, Ananam, Pajananisi. Kala is an important content, important factor for curing the diseases. Here, one medicine can be a vehicle for another vehicle. There are many examples I can show you from our science. For example, in Mutraga Rektavitta, you see, in Mutraga Rektavitta Chitsa, Acharya says that, Gogandaga Apir Sundam. വർണ്ണിനീഭിസ്തഥാവയ അന്ത്യാശ രക്തം സലിലം വിശേഷാൽ മൂത്രമാർഗം ഗോകണ്ഡക അഭീരുശ്രുതം മയ. You see, when hematuria is there, we can prepare Ksheerapada with Gogandaka and Abhiru. Actually, we all know that, Gogandaka is not at all having any kind of Rektastampana effect. But Abhiru or Shatavari is having Rektastampana effect. That also we know very well. Shatavari is Shira also. That is having Rektastampana effect. Hence, if you are preparing milk itself is having Mutra Krishnagara effect, which means that, milk is having some affinity towards the Mutravaka Srodhas. Which means that, if you are preparing Gogandaka, milk with Gogandaka and Apiru, the Mutra Krishnagara effect of, or the affinity of milk and Gogandaka takes the Rektastambhana effect of Shatavari to the Mutravaka. Once again, I can say this Apiru is having Rektastambhana effect, but it is not a vehicle. Here, Gogandaka and this milk acts as a vehicle which is taking the Rektastambhana effect of Shatavari to the urinary system, by which, Rektastambhana occurs. Which means that, if when hematuria is there, 2 doses of this Ksheerapada is sufficient to arrest the bleeding in the urinary system. That much effect is there. Which means that, there are many other examples also. For example, when Acharya explains about, Udashwayasashularto Mandagdir Gavalmegan Bibel Hingwadi and Takramba. You see, in Arshojinsa, Acharya says that, when the patient is having Udashwayathu or Udashula due to ulcers, definitely we can select, Hingvajadi Churna, which is told in Gulma Chikitsa, which is having Arshogara effect, but it should be given with Takra. Why Takra is preferred here? Acharya should have preferred hot water also, but he is preferring Takra because, Shushkeshu Bhaladagamadgrimuktam Paishajyam Ardayeshu tu Varsakatvam Sarveshu Sarvartushu Karashayam. Karashayam means Takra. Sarveshu Sarvartushu Karashayam Arsasu Delyam cha Malabhagam cha. Here, Karashaya or Takra acts as a vehicle for taking the Arshohara effect of a Gulmahara drug to the Arsho area, then to the Arsas. Once again, I can say here, Karashaya or Takra is acting as a vehicle for getting the effect of Arshohara, effect of Hingvajadi Churna, and that is why the patient is having relief with 2 or 3 doses. Usually, a lady in her, when she is pregnant, in her 3rd trimester, she may be having some level of ulcers. Physiological ulcers actually occurs, and after delivery, usually it goes also. But when the patient, when that lady is in the 3rd trimester, there may be many patients I have treated. The patient may be having, that lady may be having painful defecation. At that time, the best drug is Hingvajadi Churna with Takra. Best 2 or 3 doses will be sufficient to subside the symptoms. Then let us go to the preventive measures of Hridroga. Intake of food after having proper appetite. Proper appetite means, if you are having Yamamathena Bhoktavyam, Yamayugmam Nalankayet, Yamamathe Solpatur, Yamayugmad Verakshaya. Which means that, we should not take any food material within 3 hours. But within 6 hours we have to take. That is the theory. Within 6 hours we have to take the next food. But within 3 years we are not supposed to take any kind of heavy food, because the digestion is of the process, and in between if you are taking some food, definitely that will affect the proper digestion. Hence, intake of food after having proper appetite is very, very important. Then dinner should be very light and it should be taken at least 2 hours before bedtime. Then water boiled with dry ginger and coriander can be used for drinking. Daily exercise. Many people think that this is a modern concept. No. I always say that Ayurveda has given much importance to this exercise. In one of the texts, I think in Susrutamida, it is told that Kape Prachardhanam. In Kapa, Prachardhana is the treatment. Itte Virepo, Vasti Virane, Vasti for Vada, Shasyade, Trishabisada, Vyayamo Doshavachana. Which means that, Vyayama is Doshavachana for all the doshas, for Vada, Pitta, and Kapa. But Vamana is only for Kapa, and Viredana is only for Pitta, and Vasti is only for Vada. But Vyayama is effective for all the diseases, all the doshas. Which means that that much of importance is there. Importance is given to Vyayama in our science. Then Vyayamam Gurvado Nityam Virutham Abhivojanam Vidaktham Avidaktham Va Nirdosham Paribachite. If you are doing sufficient Vyayama, we are permitted to take some level of Virithahara or Vidaktahara because that will be properly digested with the effect of Vyayama. Hence, Vyayama is having much importance in our science for getting proper digestion, and it is indicated in many diseases like Prameha, Saulya, and other metabolic syndromes. Then daily exercise is advised. Then Hingavajadi Churna. Then if somebody is asking to me, sir, can you prescribe a single drug or a combination drug which can, if we are daily taking for preventing Hritroga, I can definitely say that if you are taking daily Hingavajadi Churna with hot water, we can prevent Hritroga because it is Pajana, Deepana, Srodoro, Tagara, all the properties are there, all the Hritroga properties are there for Hingavajadi. Hence, you can advise Hingavajadi Churna daily before food. Churnani Annasya Pura. It should be taken before food. Churnani Annasya Pura. It can be taken with hot water or any other media. Definitely that would be great because if you are taking daily, we can daily this Ama Sanjaya can be prevented and thereby Hritroga also can be prevented. Then Vegarotha, if you are telling about Vegarotha, the 3 important Vegas are Mana, Mutra, and Athovayu. Because in Rajesh Majimsa, Acharya says that Sakasam Vegasam Notha Shukra with a Sekasam Chaya, Annavana with his Tyaga, Satvara Sasehedava. 4 Hedus are there. Among the Vegarotha is also there. But this Vegarotha of 14 Vegas doesn't cause Rajeshma. Only 3 Vegas. Hrimatwadva, Kreditwadva, Hayadva, Vegamagadam, Vadamutra Purishanam. The Vegara Rotha of Vada, Mutra, and Purisha alone causes Rajeshma. It is explained in Charakamila, which means that even though we tell about Vegarotha, Mana, Mutra, and Athovayu are very important because you see when Acharya explains about the poems, this Purvariva verses, he says that Edanyeva Vivartande Jadeshu Hataramasu Nivartamano Apanoki Stayatho Margarothe Choven Anilan and Yan. Which means that he says that when Apana Vaigunya is there, that will cause the vitiation of all the other Vayus. Apana Vaigunya will cause Choven Anilan and Yan. Which means that this Mara Mutra and Athavayu related with Apana Vayu, hence Vegarotha Apana Vayu should not be done. Then tension free life. We need to explain about that. Next. Then Hridaya is a Mahamarma. I already told that. Protect it carefully even during external treatment time also. Actually, when we are doing medicine and other treatments, Hridaya should be protected. Always Shita Upachara should be given to Hridaya. Dring Mushka Hridaye Nava. It is told when Acharya is explaining about Sweda Jinsa, Dring Mushka Alpam Vamshanayor, when the Dring Mushka Hridaye Nava. He always says that, according to modern science, only 30% of cardiac patients need immediate intervention, immediate angioplasty or immediate other level of treatment. But which means that 70% of patients who are undergoing angioplasty can be medically managed. I can boldly say that with Ayurveda also, if we are getting proper time, then medically manageable cases can be treated with Ayurveda so that angioplasty can be avoided, which needs continuous lifelong medication. Next. Then this is the type I am concluding. Time is almost 9 o'clock. Hridroga is not happened due to one day apatya. It's a cumulative effect of apatyas which is practiced for years. Cumulative ama plus rodorotha plus amtarika apikata. You see, we always say that Hridaya is a sadhya pranahara mama. We always think about the external trauma which is occurring to heart. But internal trauma is also very important. In the internal trauma is also important. You can see that is also Antarika Abhikata, Satya Pranagara, results in Hridroga. Unhealthy lifestyle is followed for a very long period is the exact and premier causative factor of Hridroga. Treatment is healthy lifestyle and scientific management. There is no single drug, no Ottamuli is available for this fatal disease. Next. Thank you for your patient hearing. Actually, we spent almost 55 minutes explaining about Hridroga. This is the Hridroga line of management. Even though I explained about some medicines, many other medicines are there, and heart protecting rasayana are also there, which I already explained, like Agas rasayana, Brahmi rasayana, Janaprasha. Many medicines are there. We all know that those also can be used. Here I explained only about some medicines. There are many physicians who are having much experience in using this. But definitely you have to protect Agni, because protection of Agni is the cardinal principle of Kaya Chikitsa. That is why we are using always this Panchagore, Avaku and all the other medicines for treating the deep-seated Agni disorder. Thank you for your patient hearing, and once again I am thanking Dr. Jasoor for inviting me, and that is why I got a chance to address you people. Young doctors, definitely you are the cream of the society. Definitely you should be able to treat these kinds of cases. We always are very fearful in treating Hridroga. We need not be fearful.